Hi, this is Charisse, the nurse practitioner. I'm going to talk about low-dose Naltrexone and some of the powerful results that I see. LDN treatment involves using the medication Naltrexone in very small doses to regulate the immune system and reduce inflammation. In order to understand how LDN or low-dose Naltrexone works, it's important to look at our traditional use of Naltrexone in conventional medicine. It's a medication that's had great success as part of a complete treatment program for drug and alcohol addiction. It works by blocking the high created by opiates or alcohol, which then curbs the urge to use again, and it does this without any narcotic effect. So because Naltrexone blocks your receptors for opioids, your body increases production of endorphins to compensate. And endorphins have anti-inflammatory properties, which then means it also reduces inflammation. Treatment with LDN leverages those benefits through a low dose, typically about 1/10 of a traditional dose. And there's a surprisingly wide range of conditions that can benefit from LDN. So what do I use LDN for? Healthcare practitioners continue to find more uses for LDN therapy, and it's particularly effective for autoimmune conditions or conditions characterized by pain. Some of the primary uses for LDN, which I use in my practice, are autoimmune disease, because the anti-inflammatory properties of LDN help regulate the immune system and reduce the immunity overdrive that characterizes autoimmune disorders. For example, people with multiple sclerosis find that LDN reduces the number of their flare-ups. People with Crohn's disease report an improvement in their overall quality of life. LDN is also used to treat conditions like my husband's psoriasis, lupus, autoimmune thyroid problems, and rheumatoid arthritis. Long-haul COVID is also treated with LDN, and researchers are only just starting to understand the complexities of long-haul COVID, but initial studies point to LDN's ability to reduce the pain, fatigue, and brain fog and cough associated with long COVID. Depression, anxiety, and bipolar disorder, LDN works because it produces endorphins, dopamine, serotonin, which all play a role in the holistic treatment plan for mood disorders. Fibromyalgia, LDN reduces the inflammatory response to the nerves, which in turn can ease the symptoms of fibromyalgia. In fact, one study concluded that LDN was the most effective treatment for fibromyalgia. Chronic pain, LDN lowers your body's production of cytokines, which are inflammatory chemicals that make your tissues more sensitive to pain. Cancer, LDN can definitely be used as a safe treatment for many types of cancer, including breast cancer, bladder cancer, colon, liver, and rectal cancers. Are there any side effects? I get that question too. At higher doses, Naltrexone is associated with several side effects, particularly damage to the liver, but you're talking 100 milligrams. However, the dosage for LDN therapy are so low that most patients don't experience any adverse effects at all. A small number have reported difficulty sleeping, vivid dreams, nausea, and diarrhea, but when necessary, we can dose adjust Naltrexone to reduce further and alleviate side effects. So how do you get started with LDN treatment? You need to reach out, jump on a free strategy call with myself, Charisse, the functional medicine nurse practitioner, how LDN can be part of your holistic treatment plan. Thanks.